Check PCP orders. Gather supplies and equipment. Perform hand hygiene and maintain standard precautions. Introduce self.
Hi, Ms. Wilkins. My name is Rebecca. I'll be your nurse today.
Provide for privacy.
I'm going to close your door so we have a little bit more privacy.
Identify the patient using 2 identifiers.
Ms. Wilkins, can you tell me your name and date of birth, please?
Barbara Wilkins, 517
Okay, thank you very much.
Assess allergies.
Ms. Wilkins, do you have any allergies that we need to be aware of, specifically to latex or iodine?
No, not that I know of.
Explain the procedure to the patient.
Okay. Well, the doctor has ordered for us to put in a Foley catheter or a urinary catheter for you. Have you had one of those before?
I think so.
Okay. Well, it's a tube that goes into your bladder that will help you since you've had a hard time urinating.
Assess pain level.
Are you having any pain right now?
No, ma'am.
Okay, very good. If you start to have any pain, please let me know.
Raise the bed to working height and lower the side rails as appropriate and safe.
I'm going to raise your bed up here, so it's going to be really important that you stay really still. I do have to have your bed at my waist level, so it does have to go up pretty high. I'm going to lower the side rail here. I'm going to help you slide over just a little bit since you're over towards the side of the bed.
Perform hand hygiene. Don clean gloves. Place the patient in the dorsal recumbent position. Place a waterproof pad under the patient's buttocks and drape the patient with a bath blanket for privacy, exposing only the perineum.
So Ms. Wilkins, I'm going to start exposing you here. I'm going to pull your sheet down pretty far, and I'm going to pull your gown up so that I can have plenty of space to work. I'm also going to have you bend your legs out towards me, just to give me more space to work. There we go.
Clean the perineal area and dry it thoroughly with a towel.
I'm going to get you cleaned up first before we actually put the catheter in.
Remove gloves and perform hand hygiene. Place the patient in the dorsal recumbent position. Place a waterproof pad under the patient's buttocks and drape the patient with a bath blanket for privacy, exposing only the perineum.
I have placed this bag on your bed just so I can dispose of my trash, so just stay really still for me.
Open outer wrapping of either an indwelling catheterization kit or an intermittent catheterization kit by tearing package on paper-lined edge of plastic wrap. Place inner wrapped box on easily accessible, clean bedside table. Open the sterile inner package containing catheter supplies. Using sterile technique, fold back each flap of the sterile package one at a time, with the last flap open toward the nurse. Pinch the package of sterile gloves and set aside on the table. Remove the square sterile drape from the tray, touching the edges only. Place the sterile drape with the plastic, shiny side down under the patient's buttocks. Don sterile gloves. Place the fenestrated drape over the perineum.
Okay, Miss Wilkins, I'm going to lay this extra little drape over you just to give me a little extra room to work.
If using a cotton ball in a kit with antiseptic solution, open the solution and pour it over the cotton balls. Place the forceps nearby. If the kit contains sterile antiseptic swabs instead of solution, open the package with stick ends up for access. Open and empty the lubricant 1 to 2 inches on the catheter tip. Note, high fidelity simulators require special lubricant. Remove the cap from the pre-filled syringe of water and attach the syringe to the injection port. Do not test the balloon unless specified by the manufacturer's instructions. Move the tray onto the sterile field between the patient's legs, or have the table over bed with sterile tray. Designate your non-dominant hand as the clean hand to hold the labia open and expose the urethral meatus. Do not release the labia. Keep the clean, non-dominant hand in place throughout the remainder of the procedure. Designate the dominant hand as the sterile hand. Cleanse the urinary vaginal area using only 1 cotton ball or swab per wipe. Wipe from front to back, i.e., from anterior end of the labia toward the rectum, using a new cotton ball or swab for each wipe in the following sequence. Labia fold and then directly over the urinary meatus, side, side, middle. Discard each cotton ball or swab in the waste receptacle immediately after use. Using your sterile hand, pick up the catheter. Ensure that the tip is sufficiently covered in lubricant. Have the patient bear down and insert the tip of the catheter into the urethral meatus. Insertion should be for 2 to 3 inches or until urine appears. Insert the catheter an additional 1 to 2 inches after urine appears. Release the labia. Keep catheter secure with clean hand 1 to 2 inches away from the labia. Inflate the balloon. Gently tug on the catheter. Secure the catheter with non-allergenic tape or leg securing device. Hang the collection drainage bag from the bed frame. Dispose of catheterization equipment properly and remove bag from bed. Remove gloves and perform hand hygiene. Don clean gloves. Return the bed to its lowest position. Raise the top side rails and verify that the call light is within reach for the patient.
Ms. Wilkins, I'm going to get you all covered back up here. I have your call light right there by your hand. I'm going to get your bed lowered back down here. Ms. Wilkins, is there anything else I can get for you?
No, ma'am.
Okay.
Remove gloves and perform hand hygiene. Documentation of sterile procedure, including what type of cleaning solution used, betadine, chlorhexidine, etc., and amount of water used to inflate balloon. Note the size of the lumen inserted, how the patient tolerated the procedure, the amount, color, and clarity of urine in drainage bag, and the position drainage bag left in, secured with leg strap, tape, hung on a movable part of bed frame, and left below level of the bladder. Document education of patient. Monitor and record urinary output as ordered or per policy. Perform perineum catheter care every shift.